My name is Jared McGuire. I'm a registered massage therapist and I work at a couple spaces, one of which is a psychotherapy clinic that itself specializes in ketamine assisted therapy. So when we're talking about nervous system regulation, we're talking about trying to bring people back into a state of calm, safety. We can talk about sympathetic drive, parasympathetic drive, and with sympathetic drive, we commonly refer to that as fight or flight. So we're trying to bring people out of a state of like pseudo fight or flight and back into a state of like rest and digest and just feeling calm and safe within themselves. We're dealing with clients who are coming in with stress, anxiety, treatment-resistant depression, and PTSD, and those are the individuals that I believe would respond the most to the type of treatment that I'm providing. So we can see a lot of different physical manifestations of this sympathetic drive. There are different things we can see. We can see changes in breath, digestion, muscle tone, posture. A lot of times you'll see this, especially around the neck, where individuals are almost in this state where you could perceive it as if they're protecting themselves. We get a lot of tension through the shoulders, through the neck. So I think these bodies, spiritual, physical, emotional, all of these facets of mental health are actually intertwined. They're constantly communicating with each other, and that's where the treatment that I provide is trying to bring people back to themselves and establish that connection where they can return to a state where these different facets are actually communicating effectively with each other. The reason what I'm doing with manual therapy is effective and important to someone who's deciding to go through this ketamine experience is because in general with psychedelics, we end up creating a window of opportunity where we're able to better hear signals that are being sent from our body to our mind and vice versa. With my treatment, I'm trying to create a space where, with deliberate, slow, refined touch, we're trying to give people an opportunity to better hear those signals. And while that window of opportunity is open, I think it's an effective and important time to bring people into a space where, when they're normally overstimulated in their day-to-day life, we're giving them an opportunity to really turn down the volume on everything that's happening around them and start to hear what their body's probably been screaming to them for a really long time. So some things I look for are changes in breath, whether it becomes slower, shallower. We sometimes get something called air hunger, where you'll just have that urge to take a really deep breath and sigh it out. Other little things I see very often are micro movements in limbs, so kind of akin to those twitches that you'd get as you're starting to fall asleep. And I'd say that was the most profound change with this individual, is there were way more of those micro movements than I'd ever seen before.